Another day, another safety tips. Difference between major injuries and minor injuries. What is injury? An injury is any physical harm or damage inflicted on the body. This harm can result from various circumstances such as accidents, slips or falls, or even deliberate acts of violence. Injuries can manifest through various symptoms, including a wide range of conditions such as discomfort or pain, inflammation or swelling, bruising or discoloration, and sometimes loss of normal body function or movement. Injury severity can span a broad spectrum, from mild to severe. In extreme cases, an injury can threaten life, highlighting the importance of immediate medical intervention when an injury is sustained. If an injury is suspected or confirmed, seeking professional medical help as soon as possible is imperative to mitigate any further damage and initiate the appropriate treatment. Injuries come in many forms and types, but for ease of understanding, they are commonly grouped into two primary categories: acute and chronic. Acute injuries are sudden onset, usually resulting from a specific impact or traumatic event such as a fall, collision, or sudden twist. Common examples of acute injuries include cuts, fractures, and sprains. These injuries often exhibit immediate symptoms such as pain, swelling, and inability to bear weight or use the affected body part. Despite the sudden and often painful onset, acute injuries typically have a shorter healing period, with most recovering within a few weeks or months given appropriate treatment. Chronic injuries are more insidious and develop progressively over an extended period. They're typically the result of prolonged overuse, repetitive strain, or ongoing wear and tear affecting a particular body part. Examples include tendinitis, stress fractures, and various forms of arthritis. The symptoms of chronic injuries, such as pain or discomfort, often gradually increase over time and can persist for several months or even years. They require more prolonged and often more complex management strategies than acute injuries due to their persistent nature and underlying causes. Minor injuries. Minor injuries are generally not life-threatening and do not necessitate significant medical intervention or hospitalization. These injuries often have a relatively quick recovery time. Examples include minor cuts, scrapes, bruises, burns, sprains, and strains. While these injuries can still be painful and disruptive, they often heal completely with appropriate first aid and rest. Different types of minor injuries. Minor injuries are those that typically don't cause severe pain or permanent damage and can usually be treated at home or with minimal medical intervention. Here are some examples. Cuts and scrapes. These are common minor injuries that can occur in various settings. Most cuts and scrapes are superficial and can be treated with basic first aid, such as cleaning the wound, applying an antiseptic, and covering it with a bandage. Bruises. Bruises or contusions occur when small blood vessels under the skin break due to an impact. They're characterized by discoloration and tenderness but usually heal within a couple of weeks. Sprains occur when the ligaments, which connect bones to each other, are overstretched or torn. Ankle and wrist sprains are common and can often be treated with rest, ice, compression, and elevation, the RICE protocol. Strains. Strains happen when muscles or tendons are overstretched or torn. Like sprains, they can often be treated with the RICE protocol and may also benefit from gentle stretching and strengthening exercises as part of rehabilitation. Minor burns. First-degree burns, the least severe type, affect only the outer layer of skin. They can cause redness and pain but generally heal within a week. Blisters are small pockets of fluid in the upper layers of skin, often due to friction or burns. Most blisters heal naturally if left undisturbed. Minor head injuries can include mild concussions, minor bumps, or blows to the head that doesn't result in loss of consciousness or other serious symptoms. Foreign object in eye or skin, dust, dirt, or other small foreign objects can cause minor injury but can usually be rinsed or gently removed without causing serious harm. Major injuries. On the other hand, major injuries are typically more severe, often requiring immediate and extensive medical attention. They can be life-threatening, resulting in lasting or permanent damage or disability. Major injuries frequently necessitate hospitalization and may involve surgery or other significant interventions. Examples can include fractures, other than fingers, toes, or minor facial fractures, serious burns, deep wounds, traumatic brain injuries, spinal injuries, and injuries that might impair vital functions. Different types of major injuries. Major injuries are typically severe and potentially life-threatening or result in long-term disability. They often necessitate immediate and extensive medical intervention. Here are some examples. Fractures. These are injuries that result in broken bones. They can occur anywhere in the body, including the arms, legs, and spine, and often require immobilization or surgery to heal properly. Severe burns. Third-degree burns, the most serious type, damage all layers of the skin and the tissue underneath. They often require hospitalization, skin grafts, or other extensive treatments. Traumatic brain injuries. These injuries, including concussions, contusions, and penetrating injuries, affect the brain's normal function. Depending on the severity, they can lead to long-term cognitive, physical, and behavioral issues. Spinal cord injuries. These injuries can result from trauma to the spine and can lead to partial or complete paralysis. Amputations. This involves the loss of a limb or appendage. Amputations can result from a traumatic injury or may be required surgically due to a severe injury or infection. Internal injuries. These are injuries that cause internal bleeding or organ damage. They can occur due to a severe blow or trauma and often require immediate medical attention. Crush injuries. These injuries can occur when a part of the body is squeezed between two heavy objects, leading to severe damage to the skin, muscles, bones, and other tissues.